part 1. If you can get firm, but lose it within minutes, even during intimacy, the issue is probably not your blood flow. It is not simply low testosterone, and it is not just your age catching up with you. In most cases, the real problem lies in two small but powerful muscles at the base of your anatomy that are no longer doing their job properly. When these muscles fail to activate the way they should, blood can enter, but it cannot stay. It flows in, then quickly leaks back out, leaving you soft at the exact moment you need to remain firm. The science behind this is not vague or theoretical. It is clearly documented. Studies show that the ischiocavernosus muscles are responsible for creating rigidity by generating what researchers call suprasystolic intracavernous pressure. That means pressure inside the erectile chambers that actually exceeds your systolic blood pressure. In simple terms, these muscles squeeze with enough force to trap blood under extremely high pressure, which is what creates true firmness. Research consistently demonstrates a direct link between the strength of these muscle contractions, increases in intracavernous pressure, and the ability to maintain rigidity. In one landmark study published in a leading physical therapy journal, men experiencing firmness challenges underwent 20 sessions of pelvic floor muscle rehabilitation. The results were not minor improvements. Maximum intracavernous pressure increased by 87% in men who showed positive trends. Baseline pressure increased by 99%. Those numbers are not subtle. They represent nearly double the mechanical strength needed to maintain rigidity. Men who can stay firm for extended periods tend to have one thing in common. Their pelvic floor muscles, specifically the ischiocavernosus and bulbospongiosus muscles, contract strongly and automatically. They clamp down, trap blood inside, and maintain pressure. On the other hand, men who fade within minutes often have weakened, underused, or atrophied muscles that fail to contract adequately. Blood enters, but without proper compression of the veins, it drains out almost immediately. Today, I am going to walk you through the exact biological mechanism behind this problem, the simple 6-0-second activation protocol that can retrain these muscles, and why this technique can work the very first time you try it. Hello, gentlemen. I am Dr. Mika Hayashi, a urologist with over a decade of experience helping men over 50 restore and maintain firmness using evidence-based pelvic floor rehabilitation techniques. What I am about to share is not based on guesswork or internet myths. It is grounded in clinical trials and measurable physiological outcomes. You will learn how to activate the precise muscles proven to increase intracavernous pressure and dramatically improve your ability to maintain firm, sustained responses. Before we continue, take a moment to engage with this information actively. Hit the like button and let me know where you are watching from. When you interact, it helps this message reach more men who may be silently dealing with the same issue. Now let's break down what is really happening inside your body. Getting firm requires blood to flow into the corpus cavernosum. That part is widely understood. But staying firm requires something completely different. It requires trapping that blood inside and preventing it from draining away. That is where the ischiocavernosus and bulbospongiosus muscles become essential. The ischiocavernosus muscles run along both sides at the base. Research shows they compress the corpus cavernosum against the pubic bone. The area they compress accounts for roughly 35 to nearly 56% of total erectile chamber volume. When these muscles contract forcefully, they create mechanical compression that generates intracavernous pressures far beyond normal blood pressure levels. In some studies, pressures reached several hundred millimeters of mercury during maximum contraction. This suprasystolic pressure serves two critical functions. First, it compresses the veins that normally drain blood away, effectively sealing them off. Second, it forces additional blood toward the distal portions of the anatomy, enhancing rigidity throughout. The bulbospongiosus muscle plays an equally important role. It surrounds the bulb and compresses the deep dorsal vein, which is a primary drainage pathway. During strong contraction, intracavernous pressure rises, while venous outflow decreases at the same time. This synchronized action is what differentiates partial firmness from true rigidity. You can reach a tumescent phase through blood inflow alone. That may feel partially firm, but true rigidity, the kind that remains stable during movement and stimulation, absolutely depends on strong pelvic floor contractions. After the age of 50, these muscles often weaken significantly. They lose tone, they shrink from disuse, and they stop contracting automatically during arousal. When they fail to engage, the result is predictable. Blood enters, but without proper compression, it drains right back out. You experience initial firmness followed by rapid fading. If this explanation is connecting the dots for you, understand that this is not random decline. In your 20s and 30s, these muscles were strong and highly responsive. They contracted automatically without you thinking about it. But several factors contribute to their weakening over time. Testosterone decline reduces muscle protein synthesis and maintenance. A sedentary lifestyle leads to disuse atrophy. Pelvic floor muscles follow the same biological rule as every other skeletal muscle: use it or lose it. Enlargement of the prostate can create chronic pelvic congestion, interfering with normal muscle performance. Years of straining during urination or bowel movements may even irritate or damage the pudendal nerve, which supplies these muscles. The encouraging news is that these are skeletal muscles under voluntary control. That means they can be retrained. With the correct method, strength can be rebuilt, and automatic contraction patterns can be restored. And, before I show you exactly how to do that, you need to see the overwhelming research proving that pelvic floor muscle training works. Par deux, the evidence supporting pelvic floor muscle rehabilitation is not anecdotal. It is not based on vague testimonials or marketing claims. It is grounded in controlled clinical trials that measured real physiological changes inside the body. One of the most referenced randomized controlled trials on this subject followed men who were experiencing difficulty maintaining firmness. These participants were divided into two groups. One group received structured pelvic floor muscle training supervised by a specialist. The other group received only lifestyle advice. After just 3 months, the results were striking. A significant percentage of the men performing targeted pelvic floor exercises regained the ability to maintain rigidity sufficient for intercourse. Meanwhile, the control group showed far less improvement. What made the difference was not medication. It was not hormone therapy. It was muscle activation and strengthening. Researchers used objective measurements, including intracavernous pressure testing and standardized erectile function questionnaires. They observed measurable increases in rigidity and duration. In many cases, men who had previously relied on medication reported reduced dependence after strengthening their pelvic floor. To understand why this works so effectively, you need to visualize the mechanics. Imagine the erectile chambers as expandable cylinders. Blood fills them during arousal, creating swelling. But swelling alone does not equal firmness. If the veins remain open and uncompressed, blood escapes as quickly as it enters. This is called venous leakage, and it is one of the most common reasons men lose firmness prematurely. Now, imagine wrapping a strong band around the base of those cylinders. That band represents the ischiocavernosus muscles. When they contract forcefully, they compress the base of the chambers against the pubic bone. This mechanical compression restricts venous outflow. The blood becomes trapped under high pressure, and rigidity increases dramatically. The bulbospongiosus muscle enhances this process. When it contracts, it further compresses the deep dorsal vein and assists in pushing blood forward. This coordinated muscular activity transforms partial tumescence into full rigidity. What happens with age is subtle but progressive. Muscle fibers lose strength and responsiveness. Neuromuscular signaling slows down. Instead of contracting automatically during arousal, the muscles remain passive. Blood enters, but without that final clampdown effect, it drains away. Many men misinterpret this as purely a circulation problem. They assume arteries are blocked or hormones are too low. While those factors can contribute in some cases, studies show that a large proportion of age-related firmness issues are mechanical rather than purely vascular. The inflow may still be adequate. The problem lies in outflow control. There is also an important neurological component. The pudendal nerve carries the signals that trigger pelvic floor contractions. Chronic straining, prolonged sitting, and pelvic tension can impair this signaling pathway. Reduced nerve responsiveness means weaker contractions, even if the muscle tissue itself is not severely atrophied. Here is where the 60-second activation protocol becomes powerful. Before we discuss strengthening over weeks and months, you need to understand that immediate improvement can occur simply by reactivating dormant muscle fibers. Most men do not know how to properly engage the ischiocavernosus muscles. They either contract their abdomen, tighten their glutes, or hold their breath. None of those actions effectively target the correct muscles. To identify the right area, imagine you are trying to stop the flow of urine midstream. The muscles you engage in that moment are part of the pelvic floor. However, for this protocol, we refine the contraction further. You want a subtle lifting sensation at the base, without clenching your buttocks or thighs. Sit upright. Keep your abdomen relaxed. Take a slow breath in. As you exhale gently, contract the pelvic floor by lifting inward and upward. Hold that contraction for 5 seconds. Release completely for 5 seconds. Repeat this sequence 6 times. That is your initial 60-second activation cycle. What this does is wake up neuromuscular pathways that may have been dormant. It increases local blood flow to the muscle fibers themselves. It improves motor unit recruitment, meaning more muscle fibers fire simultaneously during contraction. Clinical observations show that some men notice stronger spontaneous firmness within days of consistent activation. That does not mean the muscles are fully strengthened yet. It means they are beginning to respond again. Over time, structured training increases both endurance and peak contraction strength. Endurance matters because maintaining rigidity requires sustained contraction, not just a quick squeeze. Peak strength matters because suprasystolic pressure generation depends on force. Another important detail often overlooked is coordination. The pelvic floor must contract at the right moment during arousal. Retraining improves timing, so the muscles engage automatically rather than requiring conscious effort. In addition to exercise, lifestyle modifications support recovery. Reducing prolonged sitting relieves pressure on the pudendal nerve. Gentle stretching of the hip flexors and inner thighs improves pelvic circulation. Managing weight reduces strain on the pelvic floor. Adequate protein intake supports muscle repair. It is important to emphasize that this is not a quick gimmick promising unrealistic overnight transformation. Muscle adaptation follows biological principles. Strength builds progressively. However, reactivation can occur quickly, and that alone may improve performance significantly. The key is precision. Random squeezing throughout the day without proper technique will not produce the same results. Intentional, controlled contractions with full relaxation between repetitions are essential. Overtraining can also create tension, which is counterproductive. Balance is critical. In the next section, I will guide you through how to structure a full weekly pelvic floor strengthening plan, how to avoid the most common mistakes men make during training, and how to measure real progress so you know the exercises are working. Part 3. Now that you understand the activation phase, let's move into structured strengthening. Activation wakes the muscles up. Strengthening builds the force and endurance required to maintain rigidity under real-life conditions. Think of this the same way you would approach rebuilding strength in your arms or legs. One light contraction will not permanently increase muscle size or power. Consistency, progressive overload, and proper recovery are what create measurable adaptation. The pelvic floor is no different. A complete weekly plan should include 3 components: slow endurance holds, fast power contractions, and functional integration. Each serves a distinct physiological purpose. Let's start with endurance. Rigidity maintenance requires sustained contraction. During intimacy, the ischiocavernosus muscles must remain engaged long enough to maintain high intracavernous pressure. If they fatigue too quickly, pressure drops and firmness fades. To train endurance, perform slow holds. Contract the pelvic floor gently but firmly. Lift inward and upward without tightening your abdomen, glutes, or thighs. Hold for 8 to 10 seconds. Breathe normally during the hold. Then relax completely for the same amount of time. Perform 10 repetitions. At first, you may only manage 5-second holds. That is fine. Build gradually. Within a few weeks, most men can sustain 10-second contractions comfortably. Over time, this increases muscular endurance and improves venous compression duration. Next, we train power. Peak rigidity depends on strong, forceful contractions capable of generating suprasystolic pressure. To build this, you perform quick pulses. Contract the pelvic floor as firmly as possible for 1 second. Release completely for 1 second. Repeat 20 times. These rapid contractions recruit fast-twitch muscle fibers responsible for explosive force. Research suggests that improved fast-twitch recruitment enhances the ability to achieve full rigidity during peak arousal. The third component is coordination and functional integration. Muscles must activate automatically during arousal, not only during exercise sessions. To improve this, practice gentle pelvic floor engagement during moments of mild arousal, such as morning erections. Perform a brief 5-second contraction and observe the increase in firmness. This feedback loop trains neuromuscular timing. Now let's talk about frequency. For most men, training 5 days per week is ideal. Each session should take no more than 10 minutes. Perform endurance holds first, then power contractions. Always allow full relaxation between sets. Recovery is when adaptation occurs. Within 4 to 6 weeks, many men report noticeable improvements in firmness, stability, and duration. Clinical data supports this timeline. Muscle hypertrophy and neural adaptation typically begin within that window when training is consistent. However, technique remains the most critical variable. The most common mistake is substituting other muscles. If your abdomen tightens or your buttocks clench, you are shifting load away from the pelvic floor. Place one hand on your abdomen and one under your glutes during early sessions to ensure they remain relaxed. Another mistake is holding your breath. Oxygen supports muscle endurance. Breathe steadily throughout each contraction. Overtraining can also create chronic pelvic tension. Symptoms may include discomfort, difficulty starting urination, or a constant tight sensation. If this occurs, reduce volume and incorporate relaxation breathing. The pelvic floor must be strong but flexible, capable of contracting and fully releasing. Progress measurement is important. Improvement may show up as stronger morning firmness, longer duration before fading, or greater rigidity during contraction testing. Some men notice they require less stimulation to maintain firmness. Others find that they regain confidence, which further enhances neurological response. Confidence is not merely psychological. Anxiety activates the sympathetic nervous system, which inhibits erection maintenance. As muscular strength improves, confidence rises, reducing performance-related stress and allowing the parasympathetic system to function optimally. It is also worth discussing the relationship between testosterone and pelvic floor strength. While declining testosterone can reduce muscle mass, resistance-style pelvic floor training stimulates local growth factors independent of systemic hormone levels. Even men with modest testosterone levels can significantly improve pelvic muscle strength through targeted exercise. Nutrition plays a supporting role. Adequate hydration ensures proper tissue elasticity. Sufficient protein intake supports muscle repair. Micronutrients such as magnesium aid neuromuscular signaling, Sleep is equally critical. Growth hormone release during deep sleep contributes to muscle recovery. Chronic sleep deprivation impairs both testosterone production and neural responsiveness. Let's address expectations realistically. If severe arterial insufficiency exists, pelvic floor training alone may not fully resolve the issue. However, many men diagnosed with mild to moderate erectile dysfunction primarily experience venous leakage or muscular weakness rather than complete arterial blockage. In these cases, strengthening can dramatically improve function. The beauty of this approach is that it addresses a root mechanical factor. Medications may temporarily increase blood inflow, but without adequate venous compression, the effect may still be limited. Strong pelvic muscles enhance and prolong whatever inflow occurs. As you continue practicing, you may begin to notice spontaneous microcontractions during arousal. That is a sign that neuromuscular pathways are being restored. Automatic engagement is the ultimate goal. In the next section, we will discuss how aging, prostate enlargement, and nerve health interact with pelvic floor performance, and what additional steps you can take to protect and optimize long-term function.